Good afternoon, everyone. We will get started right at about 12:02. We're excited for today and everyone that is joining us. And actually, it's 12:02. So let's do this. Welcome to Biolocity's Bench to Market series. Today, we're going to talk about Pitch Perfect with Delynn Plummer, who is a collaborator with Biolocity. And we're going to go into different tools and ideas and ways to help you improve your pitch to drive those funding decisions, the collaborations, and the commercialization that you're looking for. A few reminders for those who don't know what Biolocity is: a early stage medical technology philanthropic program that's based out of Georgia Tech and Emory, with the desire to move that research out of the lab and get it to the patient as quickly and efficiently as possible. The Bench to Market series is part of the education component of our program. We also have non-dilutive funding and collaboration with industry experts, as well as intensive project management for teams that are selected into our cohort. I want to remind you that we will be recording today's session, and we have a lot of other sessions in our Educate collateral that are on our YouTube channel. So I encourage you to please subscribe to our YouTube channel and go through those. Additionally, if you have an idea of something that you would like to learn about, please make sure you send that to us so that we can provide those information, those speakers to you. Now, a little bit about Delynn. Delynn has over 20 years of experience working with startups, established companies, top universities, such as Georgia Tech and Emory, and government agencies to develop creative solutions to marketing challenges. She participated in the NIH Rapid Acceleration of Diagnostics, or RADx, initiative, helping more than 30 companies with design, branding, content, and accessibility requirements as they pursued emergency use authorizations from the FDA. She's also worked closely with startups and growth stage companies across industries to launch new brands and tell compelling stories. Now, during our session today, Delynn is going to present her amazing material. Please feel free to, throughout the session, put your questions in the Q&A portion, and then we will have it as a very interactive, engaging session and answer them as we go along, as well as at the end. And so now, Delynn, I will stop sharing and turn it over to you.
All right. Well, thank you for that fantastic introduction. I will start by, let's see here, sharing my screen. And I'm going to put us into full screen mode, which for some reason is suddenly not letting me do. There we go. I'm not really one for self-promotion, but I do want to talk about myself and my firm just real briefly because I want you all to feel like you can avail yourselves of my services as needed. We do a lot with medtech founders, startups, life science companies. We also work in other verticals, but we love our science and technology work. And as was shared in the introduction, we also do a lot of accessibility work and make things super compliant. So in addition to naming and branding and website design and most definitely pitch deck strategy and design, we also do ADA compliant websites and documentation, which if you ever need to submit like an IFU or a QRI or packaging files to the FDA, it goes on a public website and will need to be accessible. So that's a little trick up our sleeve if you need us. We learned how to do that through all our work with the NIH. We also do photography and videography and animation. And I have found the animation skill set particularly useful to companies and startups as they're pitching, because sometimes you got to show what it does. And this thing that you have created may not exist yet. And an animation really does the trick. So you'll see an example of that in a little bit. We do a lot of deep thinking and a lot of strategy. I, by background, am not a scientist or a medtech founder. I'm married to one, and so sometimes I think that I am, but I'm not, and he reminds me. But I do do a lot of writing and a lot of content and a lot of messaging work. So I tend to be the kind of brand strategist person on the team. I have designers who can do everything from packaging design and website design to branding work, and who help with the pitch deck design. And then we can kind of actualize those brands too, helping with websites or email campaigns or ads or social media, as the brand extends into the marketplace, we can help with that too. So think of us. A couple work samples real quick. We worked with a life science consulting firm to rebrand them and their work, and have actually worked with some of their clients as well. We talked about the NIH work, so a lot of brand strategy work, presentation design, just a million things over the course of, well, ever since COVID, however long that's been, 5 years, 6 years, feels like an eternity. Worked on a book with a lot of the scientists who participated in that RADx program, and edited a lot of chapters from a lot of scientists. I'm not sure I'm going to do that again, but it was great. It was a lot of fun. And you're going to see the pitch deck for this client, Ventubation Systems. One of those clients where I wish I had equity. I'll tell you, this is a good one. And so we'll look at their work. But I wanted to call this out because everybody tends to choose the same set of soothing colors for their medical innovation and life science work. And this client was very willing to kind of push the envelope on colors. So they really stand out. It's a lot of fun. I'm also going to show you a deck from Infant, one of my favorite clients. I talk to them every single day, and we have been there since the beginning of their direct-to-consumer launch with their CES booth, to their pitch decks, to product naming and product packaging and website and app design. And we just finished a series of how-to videos. So this is an amazing device for bottle feeding and breastfeeding. And you'll see the deck when we get into it a little bit. And then we work with therapeutics companies too, and kind of more biotech and pharma and all of that, and do a lot of display design. So as things come up in your journey, feel free to think of us, and you'll have my contact information as we get going. Okay, so now we're going to talk about pitch decks. And I think, so what I'll do is I'll take us through some of the core elements that are either required in a pitch deck or just very much essential to a successful pitch. And then we're going to look at some decks. So I'm going to have to toggle between some different documents, and just bear with me when I do that. But I think it's nice to look at real decks and see kind of what works and what doesn't. I think what makes your job hard is that you know too much. And I feel like incredibly smart people with great wealth of knowledge tend to do two things really poorly. I don't know, this is a generalization, but one is slides. They're often a mess. And also like driving. I don't know if any of you are poor drivers, but the smartest people I know, I feel like my life is in their hands when I get in their car. I had this friend who's a Harvard professor, and he'd be like, "Darling, let's do lunch." And he would come to pick me up, and I'm like, "Oh my God, this is it. This is where I die." Professors and scientists also, just the slides are bad, you guys. They are busy and they are complicated, and you're trying to express everything that you are knowledgeable on and brilliant about, and it's too much. And a pitch is really like getting a coffee with someone, having a conversation. They're not writing the check that day. That doesn't happen. It doesn't even happen in the movies. You don't even see that. This is the beginning of a conversation. You don't want to overwhelm them, and you can't assume that their cognitive abilities are as profound as yours. So even if they are brilliant, they may not be experts by any stretch of the imagination in your lane. So you really have to simplify it. It's not dumbing it down, but this isn't a scientific paper. It's not a submission. It's not a grant application. It's a conversation starter. And so some things you don't want to do, well, actually, let me bring up this other point too. You're going to need two versions of your deck right from the jump. Ultimately, and some of you may be very experienced and have already done this with a previous company or venture, so you fully understand that there's a pitch deck, and then there's a deck that you leave behind that will be denser and more explanatory. And then there's going to be like 100 versions after that. So with Infant, that client I was talking about, when we have done countless versions of decks that are fine-tuned for different audiences, and as they move through their funding cycle and as more developments occur, the decks become different and more robust, and the versioning is sort of endless. But at the jump, having a very clean, minimal 8 to 14 page deck is critical, and that's what we're talking about today. But then also the leave behind version, because the idea of a pitch deck is that you are speaking to each slide. You don't really want them reading slides. You want them looking at slides and taking in the bare minimum amount of content on those slides, which you will speak to, but then you will leave something different behind, something that maybe has your full bio instead of just your title, or spell out something that you spoke to in the deck, but someone who maybe wasn't in the presentation wouldn't have heard. Ergo, you need to include it in your leave behind version. All right, core principles. I think I've already really covered this, but it's got to be really understandable. It needs to have a certain flow, but there is definitely no one right order for the deck, other than to say you should begin with the problem and the solution. Thereafter, you could have your team at the front of the deck, you could have your team at the back. We'll get into that a little bit, but for the most part, there's got to be a problem and solution flow to begin with, and then getting into how your product or innovation works. What is the market for it? What is the competition like? Who's on your team? What are the milestones? What kind of funding do you have? What funding are you looking for? And then that final call to action. That's kind of a typical flow. And again, we'll step through that. Being really transparent and clear, because again, investors, and I'm assuming on this this chat today that we are pitching to investors, but there are other types of pitches and other types of strategics that you might be pitching to, or maybe you're presenting to potential board members. So I'm going to say investors a lot, but I kind of mean stakeholders and potential partners in a larger way. But all the above are investing in trust, not just the technology. So don't just wow them with the tech, but prove to them that you're the right team to take that tech to market. And being investor relevant, like they do want a return on their investment. So again, it's not all about the fanciness of your technology and innovation, but ultimately how it's going to bear a return. Okay, the common mistakes. Too many things on one slide. Over citing things. I think the citations, you all are like trained to cite everything, and that's important to a degree. I think 2 or 3 citations in a deck is enough. You could always have a slide at the back. You can always have an appendix. You can always put citations in the leave behind, but you really don't want to overcomplicate the pitch. Again, it's a coffee chat. Leading with the technology and not the problem or the solution is a common mistake. And then just trying too hard to prove everything in the coffee chat version of your deck. All right, I'm going to get into the flow. Any questions before I kind of go slide by slide?
We are good so far.
Okay. I'm trying to be mindful on time because telling you all to be succinct, but I can certainly go and go. All right, the problem. So this is the most important slide, and it is a slide that people get wrong all the time, and it is a slide that can constantly be improved upon. The deck is not about the technology, it's the problem that you're solving and how you're solving it. And so this problem slide really needs to be specific and not abstract. And you have to show that you are not an innovation in search of a problem, but you are a solution to a problem that is clear and exists, and you can paint the picture of what that problem is, and you can really demonstrate what those pain points are. And it doesn't have to be that you have a solution that appeals to everyone or to a super large market. Focusing on a niche market can be incredibly differentiating and profitable. So it's not a size question of the problem, it is a specificity of the problem that is really important. It leads to how is that problem being addressed or not being addressed today. So the subsequent slide to the problem could further spotlight some of these other bullets I have in the blue boxes around why this actually matters, what is happening today, how are people not being, of this particular demographic, not being served. You can build on this problem slide with a subsequent slide, but make sure you have a single slide that very succinctly captures the specific problem. Following your problem slide or slides, you're going to speak to your solution. So how is your innovation meaningfully better than any other attempts to solve this problem that currently exist? And again, you're not looking to sell perfection, that you can solve this problem for everyone. The advantage that you have is that there may be a subset or group that you can solve this problem very specifically and very discreetly. And that is where your solution shines and is best. It could also be that, well, you solve this problem in a similar way to others, but it's half the cost, or the outcomes are 20% better, or it is faster, there isn't a middleman, it gets into the hands of patients directly. Whatever that advantage is, your solution doesn't have to be an invention that has never been on the market before, but it has to serve the demographic better and differently than your competitors. Market size is also a slide where I was even looking at a client's deck this morning in preparation for this call, and I realized we don't have the best market slide that we could have. So this one is a little bit tricky. I think people are tempted to put the entire total addressable market onto their slides. It's a $10 billion industry. It's a $20 billion industry. Like, yeah, that's true. Maybe, but you've got to work down into the serviceable, obtainable market and get as specific as possible. So versus Googling, like, how many patients have X disease in America, like, that is probably not your serviceable, obtainable market. That is the largest circle in a overlapping diagram of circles, but you need to get to your most specific market and really try and quantify that as much as you can. So we'll see a couple examples of that. Then you can get into, and again, you could change the order of this a bit. Market size could come later. I like to address it up front before getting into the product and the technology itself. You've earned the right to now show the magic. So this is where slides can get cumbersome and long, because now you want to show everything that it can do, everything that you've invented, everything that that's possible. And you got to kind of remind yourself this is the coffee chat. You don't want to come on so strong that now that you lose them. This is where you have the potential to confuse people or to make the technology seem more complicated than it is, because you're kind of oversharing on the details. Also, it's proprietary at this point too, right? So maybe you want to hold back a bit of something anyway, but you really want to illustrate how the technology works in a simple way, and ideally in a visual way. And again, going back to what I said earlier, you're assuming these people are smart, but they may not have any particular expertise unless you know exactly who you're speaking to, and you know that they do. You don't want to overcomplicate it, have a lot of jargon. You really got to kind of simplify this technology. And having a couple slides on it is fine, but if you're 5 slides, 6 slides into explaining the product, you've gone too far. All right, everyone wants to know how it really makes money. So at some point after you've shown off the razzle dazzle of the innovation itself, your business model will explain kind of how it works, who's paying, is it a payer, is it Medicare, Medicaid, is it direct to consumer, is it equipment that a hospital is purchasing, is it a razor blade model, meaning you're really making the money on a subscription or refill of the product. And yeah, and I forgot what I was going to say there. But anyway, you understand how the business model works. Sharing this in a way that will help investors understand how they're going to eventually get a return on their money is really important. It's an important slide. Then you're going to paint the picture of what else is going on around you and who these potential competitors might be. Ideally, don't say there aren't any, because that just probably isn't true, and it will make you look less trustworthy. There's probably a competitor even sort of adjacent to you, working in a similar industry or in a similar way, somebody that you can compare yourselves to, but then immediately differentiate from them as well. Within a few seconds, someone should be able to look at a table and be like, oh, they're like X, Y, and Z, but it's faster, or it's cheaper, or it's more accurate. And a table, which we'll look at a few tables, does a nice job of that. If possible, you're going to want a slide that shows what is stopping someone else from doing the same thing that you are doing, particularly if it's something related to like an algorithm that isn't patentable or something that somebody else could replicate, but you've got the secret sauce that will make it more successful, more profitable, or get it to market more quickly. Obviously, if there are patents, provisional or otherwise, this is a great place to show that off. If you have, yes.
Hey, Dylan, since we're on the market area, I want to go ahead and ask this question that's come through the Q&A right now. And the question is market coming earlier than product? So if they don't get to see your model, will market be easier or harder to grasp?
Mm. I think the market is kind of related to the problem, right? More than it is to the solution or the product. It's when you're talking about how many people, let's say, suffer from this condition, showing that market slide helps people understand, like, oh, wow, this is a very rare specific disease that doesn't have a solution, or there are many potential patients that would benefit from this, right? So that problem and market size is kind of related, which is why showing it up front makes a lot of sense. Does that answer the question?
Yes, I love that. I think it's letting people know that there is a problem, there is a market for the problem, and then here is our proposed solution to
Right.
that problem in the market that it fits in.
Exactly. And it can kind of come in either place for that reason. I think if it's particularly surprising, if people aren't aware of this market, of this issue that you're solving, having market earlier to kind of open their eyes and be like, oh, wow, this is a global issue, for example. You may not be relegated to the US. That may get them excited to then see what your solution is, right? So sometimes it also will just change as you keep pitching and as you keep presenting this. Again, the iteration never stops, so you may move that slide around.
I love that you just said that, Dylan, because I do want to make sure the audience remembers this is that there are a lot of different ways to do pitches and presentations, and it really depends on how you can tell the best story. I often say, start with heart, share your facts, and end with heart. And you want to get people to be like, oh, I want to learn more. And that tweak you get the more you present it and the more you engage with an audience. And it also will vary based on who the audience is.
Exactly. I think we have like a V67 or something on one that I'm working on, version 67. It's sorry, I don't want to terrify anyone, but it will evolve as you evolve. Um, all right, the roadmap or the forecast, this is your opportunity to paint a picture of the journey that the strategic or the investor or the partner will be on with you and where you are in that journey. So if you have 10 years of like the infant product, they had 10 years in the NICU prior to starting a direct to consumer version of their product. So in the timeline, they show that, look, we've got 10 years of research in the clinic. And now we're at this stage where we're going direct to consumer. And here's what's next. Here's how we're going to emerge in that market. And, here's where you can jump aboard. You can include in that timeline the kind of research and development of the product or your regulatory pathway. And then any other kind of partnership or commercial milestones that have happened or you anticipate happening. You may want to sort of differentiate between the things that have happened or are going to happen and the things you just hope will happen at a certain time, color coding or using clear language here. Again, proving kind of demonstrating trust by showing the difference between what's real and what's hopeful. And also, investors and partners want to know an estimate of like how long this journey is. Like, where are you in the commercialization of this product? Are we 1 year out? Are we 2 years out? Are you already in the market? You already have sales? This is all something that can be demonstrated in your roadmap slide. And then as we get toward the end, this is where you can start getting into the finances in a more granular way. What that money is going to be used for, if what you're asking for is money, tying those dollars to outcome. Is it going to be used to purchase more product? Is it going to be used for marketing? Is it going to be used for research trials? And at some point, introducing the team. So I kind of put the team at the end, but people will argue with me on that. And I think what matters is that the team is super important to anyone that you're speaking to, because the technology, theoretically, somebody else could do, or they have some other company that they could invest in. But what's unique is you. What's unique is the team that you've built and the expertise of this team. And they need to believe that if they invest in you, that you've got the chops to run with it. They want to know who you are. They want to know if you're part-time, if you're returning to your work as a surgeon, what's your plan for succession, and who on the team, is in charge of what. All of this is like super important. So you're going to want to take some time on this slide. That's why thinking about where it features is important. I have seen team slides as the very first slide before the problem. And an argument can totally be made for that, particularly depending on who's on the team. If it's a star-studded team, maybe having it at the beginning is the way to go. Again, you want to show relevant experience of the team. That execution ability is really important. And you may also want to include on that slide or a subsequent slide who your strategic advisors are, board members. You don't have to be relegated to one slide for the team. I'm going to show you a couple example team slides. I think there is a difference for sure. Turn my ringer off. There's a difference for sure between the pitch team slide and the leave behind team slide. You don't want to have full bios in your pitch deck. You're going to speak to who these people are. You do want their titles, and you may want to include logos. This is where slides start to look insane to me, so we'll talk about this. But if you can neatly and in a clear visual way include logos of brands or institutions with which your team is affiliated, that can go a long way, as long as it's not a mess. But I'm biased because design matters to me a lot over here. Also, a traction slide, if applicable, is great to kind of show if this product has been, if patients or customers have engaged with this product in any way, or if it's been written about in the media, if there's any kind of proof points of how the product or innovation has been received, a little traction slide is good. You don't have to prove that it's a success fully in the marketplace yet because you're in the pitch mode, but there may be some early revenue or certainly some publications or some other means of validation that is worth sharing as you start to wrap up your presentation. And then having a closing summary slide that kind of encapsulates everything that you've presented isn't a bad idea. You could end on something emotional too and heartfelt, like Angela is saying, having a quote or something meaningful or a testimonial, or kind of returning to the mission. Most of you are very mission driven in your work. And so kind of returning to the mission as the final beat of the presentation is a good idea. Okay, that is it for this particular deck. Before as I toggle over to some PowerPoints, do we have any questions?
We have one that I've already answered, and I answered with my perspective on it, but very happy, Dylan, to hear your perspective on it. It goes back to the citations piece of it. And I also see that being a big struggle when individuals are changing their mindset from presenting at a conference to actually presenting to investors. So the actual question was, should we keep all of our citations in the appendix while the two we choose to share in the footnotes of the slide? And the response that I gave was that yes, the majority of your citations should be at the appendix, and if they're on the slide, they should be very small and at the bottom, and maybe even in a lighter color, so they're just not distracting at all, is the response that I gave, and would love to hear any additional comments you have.
Yeah, that's exactly what I recommend too. And you'll probably see examples of that in these decks. Sometimes the citation is great if you can see in the citation like nature, or, it's like a well-known journal or publication, having that citation on the slide can give you a little boost. But usually citations are like long and kind of messy, and they can also be a distraction. So keeping it small, different color, tiny at the bottom just shows that this data has come from somewhere and somewhere reputable. And they can click through on it too in the leave behind. You can hyperlink those, which makes it easy for the user or viewer.
Perfect. Thank you.
Okay. All right.
Oh, you know what? We have one other question really
Yeah,
quick. Why don't we
sure.
do this about while you're switching? Go ahead and start switching your
Okay.
slides. And
Yeah, because this may take a second.
okay,
Go
perfect.
ahead.
So the question is, how polished your product in terms of development stage should be presented in your pitch? For example, a dirty version of what the existing version is, or a vision image of what that product would look like in the improved version. So how
Mhm.
realistic should your images in your deck be?
Yeah, I've seen it all kinds of ways. All kinds of ways work. I will tell you one quick story. We worked with a scientist from Emory on a periurethral surgical device. And when I showed up at his office, it was like a paper towel tube, like very prototypical, barely a prototype. But they had a CAD drawing that was very sophisticated and made a ton of sense. So we made an animation for them with a voiceover that played at a conference or trade show. The audio didn't work, didn't matter. Somebody saw the animation and like the whole thing was sold like within 3 months. It was like an amazing success story. The animation really, really nailed it and helped a lot. No one ever saw the paper towel tube that I saw, but no one saw a real device either. They saw an illustration. So I think you could have both. Like you could show something that is very much like a boxy in development version of what you're making. I would pair it with on the same slide or a subsequent slide, like kind of the vision for the future product. And it could be a sophisticated CAD drawing. It could also be line art. People will connect the dots. I think it's nice to sort of show what a polished version of the thing would be. Sometimes because people don't have an imagination, but if you can help them connect those dots with some sort of illustration, and that's not expensive to do. And there are so many great illustrators who can represent even very complicated technical things that really help spell it out for people. So
And
I
I
don't know. I
think
hope that was
going
helpful.
Yeah, no, I love that. And I think as well, this comes up a lot, right? And I think it also somewhat depends on the stage of where you're at, who you're
Mhm.
presenting to. And additionally, going back to that comment we had about references, right? I am astute enough if I see an image of something and it has in a very light, small font below it, asterisk, CAD of potential or something like that,
Right.
then I'm like, okay, they're not trying to sell me vaporware. They're not lying that they have something. This is what their
Right.
vision is, and I can connect those dots without seeing something that is a high school science project view.
Hmm. I think where I struggle most personally, and this is probably just a lack of understanding on my part, is when we're talking about software or AI or an algorithm, and it isn't something you can hold in your hand, but it may not be done. And I need a picture painted for me of what it actually does, what it looks like when it's doing it, and what that final result is, because it gets very nebulous when you start talking about like, oh, the algorithm does this and that, and it results in like you got to find a way to paint that picture for people. And I do feel like that's the trickier area. Um, things that are machinating in a computer background somewhere, like harder to visualize that.
I love this. I was recently talking with a team and having this very conversation, and I think too is taking a moment and maybe it's showing the image to some people that are not involved and asking them, what does this convey to you? I can think of one example of a team we've worked with that I'm encouraging to move towards a prettier image because the CAD image shows so many different moving parts that are not going to be in the final one. And I, as an engineer, just see those as a whole bunch of failure modes. And so I think
Interesting.
also you don't want to convey to the audience something that's going to have a lot of different ways to break down if that's not
Mhm.
the truth of what it is. And so taking your image and showing it to someone who is in a different field and saying, what does this look like to you? What does make sense? That kind of stuff, I think we could add value.
Yeah, that's such a good point. It's really this is where it gets into storytelling. We have a kind of a collaborator who has some AI software and he keeps wanting me to pitch it to people for him. And I'm like, I can't because I don't know what it's I need you to paint a like I'm a storyteller. What is the story here? And so I don't need to understand, I don't need to see the algorithm at work, but make me even a metaphorical illustrated story of what is special about what this thing is doing. Even if it's not literal, it's using icons or art or clip art or anything to be able to show me why this is different and special from something else. It's got to be different and better than. I don't need to know everything about how it works, right? But what is the differentiator here? And if it requires a metaphor to do it, do that. Okay, so this deck is one that is just continuing to iterate, but I like showing it because, well, for a couple of reasons. I think that the feeding journey for newborns is something that is really hard to understand if you have not fed a newborn, like actively fed a newborn, not like one time, but like you're trying to sustain the life of your newborn. It's a very stressful journey, particularly as a mom who might be trying to nurse. And that is a picture that it takes a minute to paint that picture for a room full of investors who are very often like old white men. So, like, talk to them about nursing, they don't know. And they don't understand what the challenges are, both at a clinical level, but also the patient, the mom, like, they don't know what goes on inside the head of a mom. So, this company has amazing, I think, amazing bias. I've been working with them a long time, but they have this biofeedback technology that is really innovative and helpful. And they can talk for days and days about, I mean, they're biomedical engineers. They could go on and on about the tech forever, but we need to paint sort of an emotional portrait of what's going on to investors so that they understand why a product like this is so necessary. So I don't want to tell you how many versions of this problem slide we have done, and also I actually rewrote it yesterday because it's still not quite right. Because the problem isn't just about what doesn't exist. It's why does it matter that the problem is solved in the first place? So what this slide does well is it explains that, well, there's nothing to help quantify feeding. We need another slide that explains why quantifying feeding is important at all, right? So we kind of had to stage this problem in parts. So first, yes, feeding super critical. There's not a lot of data. It's very subjective. You find out if your baby's feeding well by weighing it all the time and making sure the baby's growing. That's not very quantitative. Also, the problem is that it stresses parents out a lot. Like, is my baby feeding properly? Does he have a tongue tie? Is my baby getting any milk at the breast? Why is my baby spitting up all the time? There's so many things that happen with feeding, and the anxiety of it is part of the problem to solve. We're not just getting data for data's sake. We want to provide data so that parents are less anxious. So that's the problem we're trying to solve. So this backup slide, the second slide explains, okay, why having data on feeding is important at all. One, because it's one of the main reasons that babies have to stay in the NICU for a week, which costs money and is horribly stressful for parents. Also, feeding is an indicator, skill level in feeding is an indicator of other growth factors. So there's a lot that you can learn from this data that is valuable to clinicians and to parents. So it's not just data for data's sake. But this slide, which was so painful to put together because there were so many chefs in the kitchen on this one. But ultimately, this is the slide, the most valuable slide in the deck, because those investors who again are often not the demographic that the product is serving, have no idea that this is what's going through a mom's head and that it often leads to postpartum depression. There are things that get overlooked. It's a constant cause of concern. And I will tell you that I'm not a big, like, I don't cry. I'm not a big crier. I don't know if I'm just like cold or dead inside, but like, I really am not. It takes a lot to make me cry. And I've cried the hardest I've ever cried in 10 years because of nursing my babies. Like, I could cry just thinking about it. The stress at the hospital, it's not working. Like, am I a failure? Like, what's going on? Like, took me to my knees. And when investors are kind of given a window into that, they start to understand why this product is valuable to a consumer and why it could have legs. Because again, they were taking it out of a NICU environment and trying to bring these feeding products into the home. Investors see this slide and they're like, oh, anxious moms. I get it. There's a lot of those. They probably know some. And once they kind of understand the internal mechanisms here, now this is appealing. Then they can continue in the presentation and show, okay, look, now we got some creds. This is one of their kind of traction slides that says we've got the first FDA cleared IoT product for newborns. We've got 10 years of demonstrated results. We've got these fantastic hospitals on board. See the logos at the bottom. And so we've also got, and they actually have this slide way in the back. I moved it up for the sake of this presentation, but it goes to the point of the defensibility. They have patents and you can show that, and investors love that. They also have some market traction. So not everyone's going to have a slide like this that they can include, but they had some early press when they were launching the breastfeeding device. So they wanted to show that off as well. It's a little hard to follow the slide. It's not my favorite, but I get why it's in there. Okay, then they get into the products. So this is where the deck can start to break down because in fact, this stuff in the background is pretty complicated. They've done a good job of trying to keep the consumer interface piece pretty simple so that stressed out moms in the middle of the night can use this app and not get bogged down by the data. But when you have a biomedical engineer explaining the product to people, this can start to get pretty nuts. So Tommy, the CEO, has his own decks that I'm constantly stripping back down, where he's added tons of slides with lots of data. And for this purpose, I just took out like 50 slides. They keep growing, these slides. When I'm not paying attention, I have to keep culling them back. But really distilling down for a pitch purpose, okay, what is the product? What does it look like? How does it work? So this is just a very visual slide. There's not really text on here. It's just pictures of the app. But he's an amazing storyteller, the CEO. So he can talk and he can really explain how this device works without having to show them how the data, the analytics, and the algorithm are working in the back end. We have this great illustrator we hired from Paris who did all this breastfeeding art for us that shows how real-time biofeedback works using bioimpedance. Then we jump to the other product, which is Bottle, and we try and set it up the same way. So we have a picture slide with apps for the product and then a little how it works slide. Here again, now we have the nice picture slide with the app. And I love if you can include a little video. People love that. How this bottle works and then getting behind the scenes. Okay, what's actually going on here? The cantilever is tapping the drum is attached to the sensor is sending the data to the phone, and here the parents can visualize how they're feeding. Both of these products, if they had been around with my kids, would have been immensely useful. One for the nursing part, but the other, like, this is a great way to figure out if your baby has tongue tie. And that's the story that they need to tell when they talk about this bottle, because that's the thing that people can latch onto. Like, oh, I would buy this really expensive bottle to help understand if my kid has a tongue tie in his mouth, and that would save me a trip to the ENT and $800, right? So like spelling it out, that value proposition. The third product is, of course, the app itself. And so we have a slide dedicated to just the app. And, the main purpose of the app, which is the connectivity across the full system and being able to send data to professionals and to caregivers. So kind of like creating this full loop. Okay, so after the product, they're like, all right, so what's the market for this? And I've realized when I looked at the slide yesterday that it's not good. So, yes, it's accurate in the number of births in the US and globally. And of course, I guess every baby born and every mom and dad or caregiver of every baby is in the addressable market, sort of, but not everybody is going to buy this product. It's not free, except through one Medicare program that they're working with. But for the most part, for most consumers, it's not free. And not everybody needs it. Not everybody thinks they're going to need it. And even people who need it, that window of time where the product might be useful, they might realize they could have used it like after the fact. So they're not going to sell 4 million of them for every baby born, right? So we could have done a much better job of drilling down, like, what is the likely obtainable market? The great thing is babies are always being born, so it's a continually, like, repopulating, literally, market, and that's great. But we could have spelled out, like, what portion of the market does this really appeal to? I also do not like our go-to-market strategy slide. Need to revisit this. It's not clear. Yes, they're numbered, but starting with a state Medicaid program, which is probably the hardest of all the markets, is not the way to hook an investor. Like, we've made this look like a very tough slog. We have not made this look like an easy go-to-market strategy. So something to think about. Like, this may be how you have it in your head, but I'm not, you're trying to get somebody on board with this journey, and you don't want them to feel like this is going to be a very painful process. And starting with a health equity access program through state Medicaid does not sound like a really good time and a quick road to success. Although it is going well. Anyway, the timeline here is very visual. It's very pretty. It's a little out of date, but we do have like the key events and the dates and what was planned when this was done for 2026. So by saying 2026 and beyond, it's pretty clear that this is what we intend to have happen. And these are all the milestones that have happened to date. Use of funds, people want to know what you're going to do with the money. So having a nice, clear chart of what the goals are and where the money is intended to go is an important slide. Your people, we'll look at a couple other people slides, is important with their titles. This one doesn't really speak to the background of these folks. I'm going to take a look at a slide that does a better job of that. Let's go into this one. Any questions while I switch modes?
No questions, but I know we also want to point out some of the things that we want to make sure that people avoid doing as well. So,
Yes. Okay. I have a perfect slide for that. Thank you. Good reminder. I know we've got just 10 minutes left, so I will be succinct. This is a client that we did the branding for, and they are bringing a brand new, like a whole new area into the market. So there's a branding of the product itself, but also what the product provides. I don't want to spend too much time in here, but I do want to point out a couple slides that I think work well. This is a stats slide that makes it clear why the area of intubating patients has a lot to be desired. It talks about the risk of hypoxia. It talks about how much failure there is, and really kind of paints a very loud, bright picture here of why a better solution is needed for intubation. They go into their solution and how it works, key benefits that are illustrated with these nice icons. I want to just take a beat on the competition table. There isn't anything quite similar. So what they do is they compare kind of their approach to two other common approaches to intubation and ventilation, and make it very clear this is kind of the only system that does these, decreases training time and minimizes stress and simplifies the situation, right? So I think this paints a really quick picture that there's nothing like it. They talk about data. This is a decent, better market size slide than the one I showed you previously. It maybe has a little too much content on it. One of the things we don't want to do is make a slide too busy, but it really shows this total market, the serviceable market, and then the entry market that they are pursuing, and really quantifies that value very clearly. So I think this is a pretty successful market size slide. This is a much better go-to-market strategy. Spells it out quarter by quarter what they're intending to do. And then for their team, they have a little bit more information. It's a busy slide. It's not my favorite slide. And again, this is where the logos get a little crazy, but it's pretty impactful. So, I give it a B. Their milestones as they move into 2026 is kind of right in the middle here. And then we did a bunch of different financial slides, and we decided this was the cleanest, clearest, simplest sales to profit, revenue projections, using their colors, so easy to understand, nice and clear, and then what they need the money for, what they're seeking. This is kind of the ask slide. And their potential acquirers, like, why not? These are all companies that very well could have an interest in their product. And then a summary at the end of what those terms are, if someone were to invest. And then their summary, like, look, we're setting a new standard. This is how we want to close that out. Show you something not great real quick. The busy background of this. Let's see, present slideshow. All caps, really hard to read this. Once you start seeing a lot of capitalization, it's kind of brutal. They've just become shapes and not words anymore. And the dark slides, it's fine as long as there's a lot of contrast. You want your slides to be kind of accessible to people who may have low vision or colorblind, and you need to have a really high contrast. And this kind of fits the contrast, but it's hard when all your slides have a very dark background to them. Doesn't make for easy reading. Another version of some team slides real quick that I think are a nice comparison between the pitch deck version. This is a nice use of logos because you can better understand where these people, like, who the logos map to. So this is their pitch version, and then their takeaway version so that people can read the bios. Definitely a big difference there. I want to show you one more thing. Why do I always get this wrong? This was back in early COVID days. Everyone was trying to create different kinds of diagnostic tests for COVID. And this was a pretty clear, like, what's the problem? Like, the fast tests aren't that accurate. And the accurate tests aren't that fast. Pretty clear. Then their technology is actually really confusing. So we made an animation, which I just want to turn off the volume. I don't think it's going to play anyway. But to the point of trying to show how something works, we had a lot of fun making this art. But it would have been kind of a brutal read. So much better to just show it. And so we did. Now, there's obviously a cost associated with doing animation. It takes time and talent and budget, but works extremely well. And then you can kind of sit back and play your video during the pitch and let it do the work for you. So a little pitch there for the power of animation. And I think that's all I have. And we have 4 minutes, so I feel like that's okay. I'm kind of at time. Questions?
Alrighty, listeners, we don't have any additional questions coming up. Can you talk a little bit about the importance of consistency throughout the deck, kind of that conversation we had on the final 10% and why it's important to make sure that those are covered? So consistency, like title case, sentence case,
Yeah,
fonts,
right.
colors.
Yeah, I personally, as kind of a grammarian, have a lot of issues with people just capitalizing random words. I think using sentence case or title case for headlines, either is fine. Make it consistent. You don't want people getting tripped up over something as simple as like your headline. Take that out of the equation. Be really consistent. Using solid color backgrounds can be a real challenge, especially if you're pasting image on top of it and those images don't have the exact same background color. You're just creating problems for yourself and kind of a disconnect in the deck that doesn't need to be there. So consistent point size for your font, consistent fonts, proper use of color, not using a lot of color floods, making sure you're not pasting things with different background colors on top of other things, not having 4 charts on a slide, kind of keeping the data to make 1 point at a time on your slide. Not having super blurry photos, not having terrible headshots. I don't know why people don't get professional headshots. It's so easy. I just got mine redone yesterday. It was a lot of fun. Like, just get a decent photo. They don't all have to match, but if you're putting together a deck and there's a blurry picture of you, what does it say about you and your ability to pull something really professional together? Yeah, having high contrast, making sure things are accessible and readable, leaving them with a leave behind that has hyperlinks if necessary to go to your LinkedIn profile or a website that exists, or citations. Trying to keep a pitch deck under 15 slides. I think that's everything I can think of.
I think another recommendation I would have someone who's not you look through your deck and find all those areas. I highly encourage teams to collaborate and build their brand guide. So your brand guide should say, these are our official colors, these are our official fonts, and the sizes for things like title and text.
Yes.
Or, here's our collateral that we're going to use. And if you just pause and create that brand guide early on, and then it should be a living document as you modify things, but then someone can constantly go back and look. And I encourage you to have the most OCD person either on your team or preferably not on your team go through and find those final things, because a crisp presentation really makes a difference. I do want to remind everyone and thank Dylan for your presentation today. As a reminder, in Biolocity, we're really passionate about growing the collaborative community and showcasing the excellence that you are doing or the activities that you and your programs have. And so if you have something of that, please, make sure you subscribe to our newsletter. You can use this QR code to find our newsletter. Make sure you follow us on all of our social media channels. And we also have the ability on our website for you to submit any highlights for your team and your projects that you've done if you've collaborated with Biolocity. And then if you have additional questions or concerns, or you want to reach out to Dylan, we will put her information as well into the show notes so that you can reach out to her. You can also feel free to send us an email at biolocity@gatech.edu, and we'd be happy to respond with any additional resources. So Dylan, we know you are very busy, and we're very grateful for you taking your time to share your perspective. We also want to let everyone know that as you work in this, you will see a lot of different perspectives from different individuals. I highly encourage you to absorb those and then find what works best for you, your journey, and your storytelling, so that you can help the world understand why the work that you're doing is very important to the world and how you're going to bring it to market. Thank you so much for spending your time with us today, and we look forward to seeing you at our next Bench to Market series.